The cigarette industry, however, made a huge boom after the production of the cigarette rolling machine, invented by the Duke Company of North Carolina in the middle of the 1800s. This goes hand in hand with a lot of the Industrial Revolution, and the ability to mass produce cigarettes enabled companies to drastically slash prices and increase production and distribution. This enabled the widespread prevalence of this new product. Criticism and opposition to the use of cigarettes carry back as far as 1798 with the noted physician Benjamin Rush, who was also involved in the alcohol temperance movement, condemned the use of tobacco and noted that it had adverse health effects. Women's temperance movements, much like the alcohol temperance movements, supported controlling the use and sale of tobacco products. Despite public health efforts to curtail the use of cigarettes and sales of cigarettes' popularity, smoking both spiked after World War I and World War II as cigarette companies voluntarily donated huge quantities of cigarette cartons to soldiers overseas. This was primarily seen as a patriotic gesture in support of the soldiers at the time. However, most likely the cigarette companies knew that the soldiers would be returning overseas addicted to cigarettes and would be incorporating an ever-expanding market and demand for their product. And as you can see from the slide here, rates of smoking increased pretty much until about 1964, when at this time it was determined that cigarette smoking was identified as a serious health hazard. Use of tobacco has been on the decline ever since. Well, I should say this use of tobacco and cigarette-related products has been in decline ever since. The tobacco industry has remained strong and booming with the introductions of other tobacco-related products. Filtered cigarettes, for example, are one of the most popular forms of tobacco products that were unscrupulously and falsely marketed as being a safer product. But as you can see here, as nicotine and tar are reduced in cigarettes, smokers still obtain nicotine in higher levels, usually due to consumption of greater products and longer inhalation times. And so if you can look at the statistics, more adult males than females tend to smoke in the United States. However, less educated females make up the majority of smokers, especially with education levels less than the 11th grade. The highest percentage of smokers in this country are from 25 to 44 years old. American, Indian, Native, and Alaskan individuals have a higher prevalence rate compared to other groups in the United States. I also remember that in many tribal ceremonies, tobacco use as well as other mind-altering substances are used as a normal ingredient in their ceremonial rituals. One of the most disturbing trends about alcohol dependency rates is the increase in prevalence, according to this chart, in the use of cigarette and tobacco products among the younger generation. In response to the well-known publications of the adverse effects of cigarettes and cigarette-related products, the use of smokeless tobacco has more than tripled over the last 20 years in popularity. Some of it may have to do with some of the smoking bans across the country. Take, for example, chewing tobacco, which has always been correlated with the sporting industry, although that's been kind of decreased over the last few years. However, chewing tobacco, like other products, has been linked to cancers of the mouth, esophagus, larynx, pharynx, and the gums. Another product called snus, which is considered to be less carcinogenic, which is a tobacco-related product that goes under the lips, doesn't require chewing or spitting, has still been linked to things called carcinomas of the lips and the mucous membranes. Some new trends in tobacco products include Bittis, which are flavored, unfiltered cigarettes imported from Southeast Asia, mostly India. These products come in a variety of flavors and, contrary to popular belief, have a much higher concentration of nicotine than in traditional cigarettes. Other cigarettes, also known as Kretex, are made up about 60% tobacco and 40% ground. These products tend to have a pleasant aroma and do not irritate the back of the throat, which traditional cigarettes do, which give the impression that they are less harmful. However, it has been demonstrated they have a higher concentration of harmful toxic products such as eugenol and coumarin, which give them their flavor. Over the years, many people have switched over to light cigarettes. These were introduced in the late 1960s and account for the majority of cigarettes sold. In 2011, a federal judge ruled that the various tobacco companies must admit that they have lied about the dangers of light cigarettes. The concentration of nicotine and tar in light cigarettes are less than traditional cigarettes. However, most smokers unwillingly compensate by increasing their consumption of these cigarettes and inhaling for longer periods of time, increasing the absorption of these compounds into their bodies. In the 1990s, a resurgence in the popularity of cigars took place. Factors such as magazines, such as Cigar Aficionado, cigar bars, and restaurants that host cigar nights have contributed to the resurgence in this popularity. Once again, the evidence shows that the perception of cigars being safer alternative to cigarettes is false. Statistically, cigar smokers have about a 34% higher chance or higher incidence of cancers than cigarette smokers, and is also associated with an increased rate of pancreatic and bladder cancer as well. Hookahs are water pipes that are usually used to to inhale smokeless tobacco, which usually comes in various flavors. These items have gained popularity over the last few years, with many people considering them to be a safe alternative to traditional cigarette smoking. Accessibility of hookah products have enjoyed legal loopholes, allowing them to be utilized in many public venues where cigarettes and cigars have been banned. Hookah does contain nicotine, as does smoke, and has been demonstrated to be just as toxic with nicotine-related illnesses as cigarette smoke, however. Electronic cigarettes have enjoyed increased popularity in the United States over the last 10 years. These devices use an electronic nicotine delivery system which allows users to inhale aerosols and other substances. The products of these devices are vaporized liquids rather than combustible smoke and are thought to have less toxic byproducts than traditional cigarettes. E-cigarettes do contain nicotine, just like additional cigarettes. However, e-cigarettes are not regulated by the government. The risks and benefits of e-cigarettes use is debatable. Example of e-cigarettes could possibly cause public harm if they are used in place of nicotine and other tobacco products by youth, are used by pregnant women, former smokers to relax nicotine as they quit smoking cessation. They could expose users to secondhand toxins as well. Benefits include the possibility of helping smokers switch completely from traditional tobacco products and assisting in the rapid transmission to a society free of combustible tobacco smoke. Back in 2018, there was some legislation prohibiting the sale of all tobacco or nicotine-related products, including e-cigarettes, to anyone under the age of 21. However, the companies tend to go around legal loopholes by introducing new products on the market, one of which is a disposable type of electronic cigarette that's only meant for a single use, and the law has not caught up with the production of these products as of yet. And the prevalence of tobacco use in the younger generation has always been a big public health issue. Social and physical, as well as environmental factors that contribute to tobacco use in the youth include things like pro-tobacco media, growing up in a household where someone smokes. Uh, all tobacco use is no longer allowed on television, but tobacco companies have found other creative ways to market their materials through depicting smoking scenes on television, on the movies, in mainstream media. It may also be a genetic component that contributes more to smoking. There also may be a strong relationship between depression, anxiety, and stress, as smoking provides a temporary alleviator from these elements. Personal perceptions of tobacco use include things such as receiving positive expectations from peers, looking cool, dealing with stress, and dealing with weight loss. Low self-esteem, low socioeconomic status, and readily accessible tobacco products also seem to be factors associated with tobacco use in the younger generation. Nicotine is one of about 4,000 chemical substances found in tobacco smoke. It is a known carcinogenic with stimulant properties and characteristics that are similar to amphetamine and cocaine. As one of its major effects is stimulating the release of the neurotransmitter norepinephrine, which is responsible for its effects of stimulation and arousal, as well as its release of dopamine, which we've mentioned before, is responsible for its addictive properties. Once absorbed into the bloodstream from the lungs, it is immediately distributed to the brain and other organs in about 10 seconds. Because nicotine is so readily absorbed and distributed, cutting down on cigarettes does very little to help reduce the craving of nicotine, because people usually just subconsciously inhale deeper and for longer periods of time, balancing out its effect. You can see from the list here, normal physiologic effects of nicotine on the body include things such as increasing blood pressure, increasing heart rate, stimulating the release of adrenaline or norepinephrine and epinephrine, increased tone and activity of the gastrointestinal tract, passing things along further, which may contribute somewhat to its effects of weight loss, facilitating the release of dopamine and serotonin, which gives rise to its mood-altering effect, and affecting the CNS functions of arousal, attention, learning, memory, storage, and retrieval. So there may be some thought and some evidence that nicotine does help enhance cognitive function in the short term. That the evidence of that still remains to be seen, however. Now, there's always been an ongoing battle between public health initiatives to curtail the use of cigarette smoking and the for-profit motives of the cigarette and tobacco companies to increase sales. Uh, Back in 1998, tobacco companies collectively settled a multi-billion-dollar lawsuit lobbied against them through a collective action of multiple states. The bulk of this legislation was to win compensation and reimbursement for the millions of dollars the state and federal government spent on healthcare related costs directly related to the illnesses produced by cigarettes and tobacco. These laws also limited the ways in which tobaccos could be marketed, advertised, and distributed, especially to folks under 18. You would think that the lawsuit would have marked the beginning of the end for the tobacco industry, yet as present-day profits in the tobacco industry are soaring, efforts have been enacted to regulate and hamper the sales and marketing of tobacco products. However, profits have just soared and sales have increased, probably due to, again, the addictive nature of these substances. Federal legislation has set the age of 18 as the minimum age to purchase tobacco. Massachusetts has put forth laws that forbids police officers and firefighters from smoking not only on the job, but off the job as well. In 1990, almost all American airlines banned smoking, and many individual states have also enacted workplace smoking policies. Now, this is an interesting question to give you food for thought. Private and public companies Do they have the right to regulate what one does in the privacy of their own home, especially considering a legal substance such as tobacco? For example, a hospital in Pennsylvania, the St. Luke's Medical Center, which controls a number of different hospitals in the Lehigh Valley, have made it its hiring practice that a person is not allowed to smoke either on or off the job. How that is enforced is a little bit beyond what I can understand myself at the time of this recording, but does a private institution have the right to employ those kind of practices? Again, that's just some food for thought for you to think about. Might make for a good discussion question at some time. Now, efforts have been employed to curtail the availability of tobacco-related products, mostly due to the increase in taxation of tobacco. It is pretty much known that as the cost of cigarettes goes up, use usually goes down, at least hypothetically and in theory. However, there's been no substantial evidence that increasing taxation on cigarettes plays a decline in smoking. There is some evidence, however, that the increased taxation on cigarettes leads to an increase in the black market sales of cigarettes, as well as importation of tobacco products from states with lower sales tax and Indian reservations as well. Now, getting back to the physical effects of tobacco on the individual, the physical effects of nicotine are well known and affect almost every major organ system, including the central nervous system, the respiratory nervous system, the cardiovascular system, and even the integumentary system. And like it says here, it is estimated that smoking is responsible for 1 in 5 deaths, either directly or indirectly. And life expectancy for smokers is about 10 years less than non-smokers. That's why if you're a smoker, you'll have a very difficult time getting an affordable life insurance policy at an affordable premium. So, as said before, the physical effects of tobacco affect just about every major organ system. Smoking contributes to premature aging of the skin. As you can see the slide here, it's a depiction of two identical twins, one who smokes and one who does not smoke. You can see the greater onset of wrinkling and sagging skin in the identical twin who does smoke. And the reason that this happens is because nicotine is known to degrade and destroy underlying collagen, which makes up the connective tissue component of the integumentary system, or the system that makes up the skin itself. Nicotine has been implicated in approximately 1/5 of all cardiovascular events, and it does so by the way it chemically alters the anatomy and the physiology of the cardiovascular system. For one thing, nicotine is a potent vasoconstrictor, meaning it causes tightening of the blood vessels and reduced blood flow to all major organs, including the heart itself. The carbon monoxide found in tobacco also reduces oxygen carrying capacity of the circulatory system. And by and large, though, one of the biggest way that nicotine contributes to heart attacks is by the way it chemically alters the way coronary arteries, or the arteries that feed the heart itself, release a substance that inhibits blood clotting. It's the inappropriate clotting of blood that cuts off blood supply to the myocardium, or the heart muscle itself, which is in the result a heart attack, which leads to destruction of the heart muscle. If it's a small area of heart muscle, the heart attack damage may be minor. If it's a huge area of muscle, it may be fatal. It is the same vasoconstrictive and thrombogenic activity of nicotine that is seen in heart attacks, which is also a major contributor to stroke. Stroke can be defined as an interruption in the blood supply to the brain. There are two major ways in which this can happen. A blood vessel in the brain can rupture, resulting in bleeding to the brain. And again, nicotine can contribute to that by destroying the collagen makeup of the blood vessel structure itself. This usually occurs about 15% of the time with all strokes and results in a very poor prognosis, usually resulting in permanent disability if not death. The other type of stroke is known as an ischemic stroke, which results from a blood clot or blockage of the major blood vessel to the brain. The mechanism by this is very similar to that of what occurs during a heart attack: vasoconstriction and abnormal blood clot forming. It's long been established that tobacco consumption is the number one preventable cause of both heart attacks and strokes. Now, in the United States, we know that heart disease has remained the number one killer of adults for many, many years. And as we mentioned, tobacco is the number one preventable risk factor of that. What's recently come up as number two killer, according to CDC statistics, is chronic respiratory diseases. The most common, which we call chronic obstructive pulmonary disease. And there are two major categories of COPD, with cigarette smoking being the most common causative factor in both. The first example is something called emphysema, which results in the destruction of the alveoli of the lungs. And as you might have known from anatomy and physiology, the alveoli are necessary for oxygen exchange from the respiratory system into the bloodstream. Long-term cigarette smoking results in destruction and loss of recoil and surface area of the alveoli, leading for less surface area for gas exchange to occur in the lungs, and decreased ability of the lungs to recoil or snap back after inhaling, which ultimately results in air trapping and difficulty pushing air out of the lungs. Common signs and symptoms include restlessness, fatigue, chronic cough, and weight loss. The other major category of COPD is something called chronic bronchitis, which is defined as a productive cough for at least 3 months out of the year, for at least 2 years in a row. This results from nicotine's ability to destroy the ciliary lining of the respiratory passages. The cilia are hair-like projections within the tubes of the bronchioles, which are necessary for sweeping out dirt, dust, and debris that oftentimes we don't even think about. Without this ciliary mechanism, dust and other particles become trapped within the bronchioles and require thick mucus secretion and a forceful cough to discharge these particles. Although quite often these processes overlap and occur together, people with chronic bronchitis are usually referred to as blue bloaters due to the bluish effect on their skin from a condition called cyanosis, and the fact that this condition also affects the cardiovascular system, resulting in fluid retention and edema, resulting in that bloating appearance. Whereas people with emphysema are sometimes referred to as pink puffers due to the appearance of what's called pursed lip breathing and a pinkish complexion due to increased red blood cell production as a compensatory mechanism. After diagnosis of either one of these conditions, the average lifespan prognosis is not good, usually approximately 5 years. And it's been well known that tobacco has been implicated in many types of cancers, including lymphoma, carcinoma, bladder cancer, oral cancer, and as most commonly known, lung cancer. Once symptomatic lung cancer has been diagnosed, 5-year survival rate remains poor and less than 20%. And quite often lung cancer is discovered incidentally when other things are being looked for. Tobacco also has a well-documented adverse effect on the developing fetus in pregnant women. Offspring of women who smoke have been documented to be born with lower birth weight, more susceptibility to infections. There is also a higher statistical prevalence of miscarriages in women who smoke, as well as stillbirth. There is also a higher concordance of sudden infant death syndrome, which is one of the most horrible things to ever have to confront as a medical provider, let alone as a parent. And just to mention the dangers of passive smoke, as seen in this slide, passive or environmental tobacco, as it's mentioned, are major sources of indoor pollution and health risks as well. Mainstream smoke results from a smoker's exhalation after inhaling. Side stream smoke is smoke that comes out of the burning end of the cigarette, which is also thought to be even more toxic than inhaled smoke from the cigarette, being that the smoke that comes out from the other end is not filtered, as is on most other cigarettes. As you can see, there's a very high concordance of breast cancer, lung disease, lung cancer, type 2 diabetes, asthma, and respiratory infections as well. So, one of the most popular smoking cessation therapies is nicotine replacement therapy. This involves the delivery of the active ingredient in tobacco, nicotine, in forms that do not introduce the other harmful chemicals in tobacco, such as tar, carbon monoxide, just to name a few. There are many products available, including gum, patches, inhalers, and lozenges. At first, these products were only available by prescription. However, over time, since about 1996, most of these products have become available over the counter. Nicotine replacement therapy appears to be less successful in other tobacco-related products, such as chewing tobacco. Another limitation of nicotine replacement therapy is that it only curbs the physical craving for nicotine, but does nothing to address the social and behavioral factors that are accompanied with addiction to tobacco, and the factors that need to be addressed when trying to abstain from tobacco. There are several drug therapies available to help smoking cessation, as well as the most popular ones are bupropion and Chantix. Bupropion, also known as Wellbutrin, is an antidepressant, and we'll be talking about that next week. Atypical antidepressant medication that was introduced in 1997 alongside with a complete smoking cessation package called Zyban, which had included a hotline and behavioral therapy programs as well. How bupropion works is unclear. It does have an affinity to stimulate dopamine receptors. Side effects usually include restlessness, insomnia, and dry mouth. There's also a danger for lowering of a seizure threshold in persons with epilepsy. Chantix is another form of therapy on the market that's been shown to be 3 times more effective than placebo. It's also shown to have a greater success than nicotine replacement therapy. The downside of Chantix tends to be the cost. There's also been some studies regarding other types of antidepressants such as Prozac and Zoloft, which results have been somewhat unclear as of yet. Aversive therapy involves the use of negative feedback mechanisms to help modify a person's desire to smoke. One technique is to have the smoker engage in rapid smoking until they exceed their tolerance to become ill. The point is to make smoking as unpleasant of an experience as possible. The obvious drawback to this, as one would think, would be the danger to someone's individual health. The premise behind behavior modification is to basically change habits and behaviors that are linked to smoking. For example, if one tends to have a cigarette after dinner, one would be encouraged to go for a walk or do something different instead. If someone is used to smoking while talking on the telephone, it would be encouraged to do something else like drawing or doodling or any other type of activity. Behavioral modification in any form usually seems to work best when it's paired up with other forms of treatment such as medical therapy. And acupuncture and hypnosis have become popular modalities over the last few years for smoking cessation. However, the evidence for their effectiveness is minimal at best. Anecdotally, people will tell you that they believe it helps, and there may be to some truth to that. However, there's been very little evidence, medically supported evidence, to support the effectiveness of these modalities. That being said, though, they both appear to be relatively safe treatment remedies, and most people do report some anecdotal success. And so to wrap it all up, just remember for this week's lesson, we want to summarize the importance of tobacco to the U.S. colonies, analyze the factors that lead to the popularization of cigarettes, assess the medical costs linked to tobacco use, explain trends in tobacco use over the past century. That's something to be followed in your textbook. Explain current trends in tobacco among the U.S. population. Compare and contrast benefits versus risks of e-cigarettes from a public health perspective. Describe the adverse effects that we mentioned by secondhand smoke. Identify factors associated with tobacco dependence, the connection between heart disease, cancer, and respiratory conditions, the effects on maternal smoking and fetal development. We didn't really talk too much about the influence of advertising on tobacco use, but that's something you should read up on. And again, list the various smoking cessation techniques and evaluate their rates of success. And with that, have a wonderful week, and we will meet up on this next time.